Tamara Hart, and I am going to just wait one more minute before we get started. I just want to give people 1 minute to get back to their offices and log on if they want to. And I think we'll get started around 12:02. Okay, so we're at 12:02. So I am going to get started just so people can get off in time. My name is Tamara Hart. I'm the program manager for patient and family education at the Odette, and or actually for the cancer program. I shouldn't say the Odette, for the cancer program. And I'm also the strategic lead for patient and family education corporately. And so I lead the work in patient as educator, which happy to chat more about if we have some time during this session. But today we're really going to be focused on what happens within the cancer program. So welcome to our grand rounds. And today we're going to take a little bit of a different approach. We have two of our patient education specialists here today, Alima Lalani and Kirsten Broders. And the way we really want to talk to you today about what services we offer is through the voice of the patient. And so you're going to hear about two patients, and we're going to talk to you about their stories, and really their stories as they kind of navigate through the cancer program here at the Odette and what that looks like from an education perspective. So without further ado, I'm going to hand it over to Alima, and she's going to start us with one of our patient stories.
Thanks, Tamara. So this is Louise, and Louise came into the Pearl earlier this year in about springtime. She came to the program to really look for some information on how she can talk to her kids about her cancer and what was about to happen. And so that's a picture of the Pearl. Many of you may know it. It's on T1. The first floor of T-Wing next to the main reception. So she came into the Pearl and she met the Pearl volunteer, and his name is Bill. And Bill's looking very handsome over there. So Bill's role is to provide patients and families with access to current and reliable health information. So he gave Louise a pathfinder on talking to your kids about cancer. And so a pathfinder is really a way for patients to start their search for health information. It gives topic-specific resources in different formats to help accommodate patients' learning styles. So we know that some patients like to read, some patients like to speak to other people, and some are just audio-visual learners. And you don't have to be one or the other, but you can be all of them, or you can just be one of them. But we all learn in different ways. And so a pathfinder is really is a way to for a patient to start their search for information in different formats. And we have 49 of these pathfinders around the center. And so Bill's role as a pro volunteer is to connect patients with that health information, which is why he gave the Pathfinder. But it's also to connect patients with resources and services in Odette and within the community. So he offered to take Louise to the Patient and Family Support Office to talk to someone down there as well. And Louise at this time was not ready to talk to anyone, so she declined that, but took down their contact information. So a month or so later, Louise stopped by the Pearl again, and this time she borrowed a book. And in the Pearl, we've got several books. The particular book she borrowed was on surviving cancer. When she came back to the Pearl a few weeks later, she came to return the book, and she met patient buddy volunteer Gloria. And as part of Gloria's role, she actively listened to Louise, offered some support, friendly support, and some comfort and some guidance as well. Louise told Gloria that she had ovarian cancer and that it's been very hard and tough coming to Odette alone. Of course, with her visitor policy, she was coming alone. And Gloria showed empathy and offered to sit with Louise in the waiting area. During their conversation, Gloria thought that Louise would benefit from chatting with someone who's had a similar cancer experience. And so she offered some information from Ovarian Cancer Canada and talked to Louise about their peer support program. And so Louise was very grateful for this information. Louise came back another time, a few weeks later, and she spoke to Gloria again. And this time Gloria, she mentioned to Gloria that she had noticed some changes in her hair and skin. So Louise was going through chemotherapy and she was starting to lose her hair and her skin was starting, there was some changes happening with her skin. So Gloria spoke about how helpful the Look Good, Feel Better program was for her and how it helped in her cancer experience. So Gloria encouraged Louise to call the nursing line as well. And if she had any concerns, to talk to a nurse about those specific changes. Louise talked about needing a wig and that she had some financial concerns. So at this time, it wasn't a priority for her to get a wig. But Gloria offered Louise our free wig program and helped her to find one on the online catalog. And so the Odette Cancer Program, at our cancer program, we do have a free wig program. Patients can go online at sunnybrook.ca/OCC wigs, and they can look through the catalog. There's about 60 wigs on there right now. And then when they find one that they like, they can email us at patienteducation@sunnybrook.ca, and we'll arrange a pickup for them so that they can get the wig home. And they can borrow it for as long as they need it, and then just return it back when they no longer need it. So a few weeks later, Louise emailed us at patienteducation@sunnybrook.ca to ask for some information on post-treatment care for ovarian cancer. So she was now done her treatment, but wasn't sure what was going to happen next. And so we sent her this booklet from Ovarian Cancer Canada and encouraged her to speak with her doctor or call the nursing line. She later emailed us to ask if we could help her connect with art therapy. And so we helped her connect to the weekly art therapy program. And we also followed up with the art therapist to make sure that that she was appropriately registered and getting the weekly emails, the weekly Zoom links. So about a month after that, Louise came back into the program to find some information on TURBT. So TURBT is transurethral bladder tumor resection. She explained that her cancer had spread to her bladder, and she needed some information about what would happen after that surgery. And so the Pearl volunteer connected Louise with some information from Canadian Cancer Society and also encouraged her to speak to her surgical oncologist and the nursing line about some post-treatment and follow-up care. At that time, Louise also saw patient buddy volunteer Gloria, so they had obviously built some rapport and made a connection. And they spoke about this time about how uncertain Louise feels about her surgery and how she's worried about her kids and who would look after them in the recovery phase. So Gloria offered to take her to the patient and family support office. And Louise said she'd think about it. So once again, said she would think about it, but again, took down their contact information. So since then, we haven't seen Louise. It's been about a month now. And I think from this example of Louise, we can see really how she has interacted with our program over the past 8 or 9 months, how we were able to provide her with some health information, some volunteer support, connecting her with community resources, but also some services in-house. And we can really see how over the time, how she's gathered little bits of information from us. So now I'm going to pass it over to my colleague, Kirsten, who will share another patient story.
Thanks, Lima. So I'm going to spend a little bit of time talking about another patient that has interacted with our program many times over the course of many months. This is George. George was diagnosed with colorectal cancer. And I'm going to share the ways in which he's interacted with our program to get the information that he's needed throughout his cancer experience so far. So one of the first ways that George, and in fact, many of our patients interact with us is through our program website, sunnybrook.ca/cancer education. Our website is really an online center or hub for all different types of cancer-related information. Through the website, patients can get information about different types of cancer, cancer treatments, managing symptoms and side effects, learn about the different classes, workshops, and events that we're offering, watch helpful videos, and also learn about the services and supports that are available to them. And it was through our patient and family education website that George learned about a colorectal cancer event that we were offering. The colorectal cancer event we were offering was part of the Florence Winberg education series. And once he learned about it through our website, he registered for that and attended. The colorectal cancer education event was just one of the many education events that we offer to patients and families. And you can see some pictures on the slide from that event. Many of our education events are done through the Florence Winberg Education Series. This is a series that is donor funded. It's something we offer to patients and families with the goal of providing them with cancer information to empower them with knowledge and support to improve their cancer experience. So we offer anywhere from 6 to 10 events per year on disease-specific topics like colorectal cancer or on hot topics, so things like cannabis and cancer. And so the information giving during these events is really delivered through a team-based approach with a focus on patient educators as a priority. We know that our patients teach us so much, and it's important for other patients and staff at the center to have the opportunity to learn from patients, which is why this is such a priority for us. You'll notice from the pictures that this event was done pre-COVID. Due to COVID, we've had to pivot our events to an online or virtual format. Prior, these were done in large group auditorium-like settings. So for this event, and like many of our other events, George was able to get information about his cancer care from many different teams across the cancer program and from organizations outside of the center that also support patients and their families. So for example, George was able to get information about nutrition from Rachel, a registered dietitian with the Patient and Family Support Program. He was able to get information from Dr. Yushko, a medical oncologist, about advancements in colorectal cancer care. George was also able to hear from Colorectal Cancer Canada and Wellspring about some of the supports that they offer. And during this event, George was also able to learn from Ryan. Ryan's on the left of our screen here, and he's one of our patient educators. And he came to the event to share his experience with colorectal cancer and offer tips and advice to George and many other patients based on his cancer experience. So we know that many of our patients, like George, value the education events that we offer as part of the series. And I'd like to read to you some of the testimonials that we've collected over the last couple of years since offering this series. One patient says, "I wanted to thank you for putting this event on. It was very informative and it answered a lot of my questions. When I heard Patient as Educator's story, it reminded me of my journey to date." Another patient says, "Thank you so much. I'm only 37 years old, and this has been a very overwhelming experience. This presentation has been very helpful." And lastly, "This event gave me a better view of what I may expect, where I can go, and who I can talk to. Again, thank you." So in addition to the Winberg series, we've also been offering other education events based on current needs and patient interests. And as I mentioned previously, when COVID hit, we had to transition our education events to an online format. So it was actually during COVID when George went back to our program's website to see what was being offered given the pause on in-person events. It was at that time he learned we were offering a COVID-19 and cancer webinar series and decided to register and attend the series. What's interesting here is that although our events have transitioned into an online format, we've still been very successful in reaching patients in similar ways as how we used to when we were doing them in person. So this is a series that is being offered in collaboration with Dr. Simran Singh, medical oncologist here at the center. And really the goal of these webinars was to give patients and their families up-to-date information on cancer and COVID-19 and vaccines, and really a chance and a platform to ask questions that they had. We know that this information is changing rapidly, and so to give them an opportunity on an ongoing basis to learn more and then to come with their questions is something we thought was very valuable. So to date, we've had 6 webinars as part of the series, and we've had over 200 patients like George attend the series. So similar to with our Winberg series, we've also had a lot of positive feedback. I'll just read a couple of the testimonials as well. I listened to the webinar last night and really thought it was very informative and well done. Another patient says, "Sincerely hope we continue them as they are so informative and educational, especially during these hard times." Another patient says, "Thank you. Fantastic presentation, very informative. We look forward to receiving information about a date for the 3rd shot. And lastly, thank you for a very insightful session." So George was also informed that he would be needing chemotherapy. And due to COVID, many of the teaching that was taking place in person in the center was no longer able to be done due to capacity restrictions and social distancing requirements. So like many of our education events, we also moved a lot of our teaching classes online as well. So since George will be needing chemotherapy, he had the opportunity to attend our Introduction to Chemotherapy class. This is a class that is offered in collaboration with patient education, nursing, and pharmacy. It's a Zoom class that happens every Tuesday from 3 to 4. And it was through this class that George was able to learn about how he could prepare for his chemotherapy treatment, how he could manage his symptoms and side effects, and the services and supports that would be available to him throughout his cancer experience. And so in addition to the chemotherapy class, we offer many other classes online as well. And again, this is made possible with much collaboration between teams across the program. Some of the other virtual classes we offer are Introduction to Lymphedema, an online Introduction to Immunotherapy class, what to expect after your breast cancer surgery, and what to expect after your melanoma surgery. And we've also made a few of our classes available on the website in the format of a video recording. And you'll see, you would have saw that on the last slide, just on the right-hand side there. So after George began chemo, he reached out to us again through our patient education email, patienteducation@sunnybrook.ca that Alima had talked about. And this is a way that George has interacted with us and many other patients and families. They often will email us and seek support in this capacity, whether that be looking for general health information, asking questions regarding their treatment or cancer-related side effects. They may be interested in joining a support group and just don't know where to look. And so as a program, we respond to these, we triage these requests accordingly. We leverage the connections we have with the different teams across the center to help patients get the information that they need. So George emailed us shortly after beginning his chemotherapy treatment. He explained that he was having some problems with some of the side effects of chemotherapy. He was having trouble eating and keeping some fluids down. So in response to George's email, our program sent him a copy of Ontario Health's Loss of Appetite Symptom Management Guide. I'm sure you've seen many of the symptom management guides here in the center. We also have them available electronically as well. We also directed him again to our website where we have helpful videos on managing loss of appetite. And we also have a video from our patient educators on appetite and nausea. We also referred him to the Nutrition Resource Center here at the Odette Cancer Center so that he could speak to a dietitian to get some help with managing those nutrition-related side effects from his treatment. And lastly, we gave him the Odette nursing line, and he was also advised to let his chemo assessment nurse know how he was feeling at his next appointment. So I'll just wrap up here by saying that I hope it's been helpful for you to hear and learn about the ways in which George and Louise have interacted with our program and hopefully give you a better sense of how we help patients and families get the information they need. We can see from George that George really sought support from a distance. He went to our website, he sought out our virtual classes and events, emailed us, and was able to download and print electronic versions of our website. So I'd just like to thank you for listening, and I'll pass it over to Tamara now just to share some final takeaways and some other updates from our program.
Thanks, Kirsten. So I think that what we really wanted to come to today's grand rounds with was this kind of takeaway that really our role is to provide opportunities for patients and families to be engaged, knowledgeable, and equipped with the information to participate and contribute in their cancer care. So we want them, if they choose to be, if they want to be actively involved, we want to just make it so that there are no barriers to accessing that. And the other thing that I think is really important to note here is that, we have patients and families that interact with our program throughout their cancer experience at different times and in different ways. So, really what we're trying to say here is that I think the tendency sometimes is we want to kind of give them all the information right up front. And that really isn't necessarily the best way that we can provide that education or that information to them, because as you saw through those two patient stories, people tend to have different questions that arise at different points throughout that trajectory. And so what we're really trying to say here is that there's lots of opportunities for them to access that information. There's lots of ways that you can provide that. And that sometimes it really is around the timing. And in fact, I would argue that most of the time it is. So, when they're first diagnosed, that they're getting a lot of information thrown at them, and they may not hear Pearl at all, even if you're doing your best to communicate that to them. So we would say communicate again around the Pearl, around patient education, and know that we are always here to answer those questions, whether it be in person or virtually. And then finally, I think the thing that was emphasized here is that we can't do this as a one, siloed service, that we really depend on all of the teams to be able to collaborate with us in creating the education and also linking patients and families to that education. And so we need to really emphasize here that obviously we are here to take any recommendations or suggestions, to take patients as they come to us through the Pearl. But we want you to know too that we depend on you heavily to connect patients with us so that we can actually do the handoffs to patient and family support, or so that we can actually give them the information about the Wimberg Education Series, and anything else that they may need. So I think that, those are just things that we really want to emphasize here, is that patients, you can see, interact with us through a number of different ways. And we depend on you to make sure that they are connected, and we will connect with you with them appropriately. So just want to go on to the final piece, which is just to introduce you to the whole team. Obviously, you've met myself, Kirsten, and Alima, and you've heard a little bit about their roles. Helena is our administrative assistant, and she really is key to making sure that all of the behind the scenes sort of things work, so that if people have any kind of issue in terms of connecting with any of us, she can be the first go-to. She does everything from scheduling all of our team meetings and the meetings we have with you, through to registering patients for our Wimberg Patient Education Series events. And she also has a role in terms of the WIG program. We went from a physical WIG program to now one that you can see online through the catalog, and Helena has a huge role in that. Kirsten, you've heard from, and she does all of the patient education, or met a lot of the patient education resources, as we all do. That's sort of our core kind of competency, or our core sort of work, but she also runs the Wimberg Education Series. And Alima, although also does a lot of the writing of the patient education resources and the website and many of the other things, is a big responsibility that she has is with operating the Pearl operations. And we have new to the team, Olga Florian, and Olga is the person that is going to now be stocking all the patient education materials in the breast center, in the cancer center, on the inpatient units, on the cancer inpatient units. And she also orders that material. So she really is essential to making sure patients and families get the information, and that you're able to get those resources in clinic. And new to the team too is Anoja Salvaraja, and Anoja is working on a number of different things. She works with Jan Stewart with the Patient and Family Advisory Council and the CCO reporting, but she's also going to be working with patient education team, and she's going to start to do oversight of our patient education volunteers that work in the Pearl and also throughout the center. And last but certainly not least, our patient buddy and Pearl volunteers. They're essential. They are there every single day. They're the faces of patient education. They help with all of the questions that come in through the Pearl, and they really are overseeing or operating. They're there kind of answering questions that patients have, doing the handoffs to patient and family support and to the nursing line and any other thing that's required. So they are absolutely critical to our services. And I just wanted to introduce and point out to you, although she's not part of the patient and family education team, Sunnybrook, under the education portfolio, which is overseen, which is directed through Dr. Ari Zaretsky, has now appointed program education leads. And they are, we have representation now from Bone and Joint, from Schulich, and now from Oncology. And Dr. Danielle Vikas is a new program education lead, and she's going to be working on high performing teams, simulation, and patient as educator. So we hope to hear more and work more with Danielle on, actually really bringing patient as educator to the forefront. So just to just note that if you want to connect with us, if you want to connect patients and families to patient education, they really can connect through virtually through sunnybrook.ca/cancer education. So they can get all sorts of information on the website. You and patients can email, and families can email us directly at patienteducation@sunnybrook.ca. We respond to those emails in a very timely way. And that's how we connect with patients and families virtually. The Pearl number is 4534 internally. And 416-480-4534. Again, we pick up those voicemails, we return calls to patients, and that's where they can actually get also a Pearl volunteer that might answer and be able to direct them. And just a reminder, we emphasize this a lot, but we want you to know that if you are working with a patient virtually, or you don't have the time to run out to clinic and grab a patient education resource, you have on all of your desktops Library World. So you just connect right into Library World and to get those resources. So we'll open it up to questions now. So I don't see any questions coming in or comments. If people have anything that they want to connect with us on, any ideas for new services or anything that wasn't answered, we're happy for you to do that at any time. You can, again, email us, or you can connect with any of us by email. I see that I've got something here. Thank you for presentation. Do you have any resources around the use of complementary and alternative therapies? So I'm going to just pass it over to either Kirsten or Alima.
Sure. Thanks for the question. Yes, we do actually have a pathfinder on complementary and alternative medicine. If you don't mind just typing your email in the chat box, or even just directly to one of us, I'd be happy to send you an email with it. And of course, everything is also available on Library World. So if you go to Library World and you type in complementary and alternative medicine, you will see the pathfinder there as well.
Anybody else? Any final questions? Alima, I don't know if you can see anything in the chat.
Yep, there's one. Sorry, I was just trying to show, I don't know if you can see my screen where I'm looking at Library World. Can you see that?
Not right now, no.
Not right now, no.
Okay. Sorry, my share doesn't always work so well here. So yeah, as Kirsten mentioned, it is called Complementary and Alternative Medicines. It's a pathfinder, and we also have Canadian Cancer Society that has a very similar topic as well. And you can find theirs, it's on Library World as well, or you can pop into the Pearl, and I'm happy to give you a copy of that one as well.
Okay, so again, thank you so much for joining us today, and please connect with us if you would like to, or any final thoughts. It is recorded. If you, I think, want to view it, you can connect, I believe, with Antoinette and get the full recording of it. So we're giving you another 27 minutes back into your day. So thank you for joining us, and we hope to connect with you soon. Thanks. Bye-bye.